Okay, I'm gonna knock on the door and I'm gonna introduce myself. Hi, I'm Paige. I'm gonna be the PA performing your eye and your ear, nose, and throat exam. I'm gonna wash my hands over here. Okay, first thing we're gonna do is we are gonna start off by testing her visual fields and visual acuities. So we're gonna first start by doing distant testing. So this is a modified Snellen chart for the sake of this, but I'm gonna end up having her test both eyes and then each eye individually. What we'll do is stand 20 feet back, but for the sake of now, I want you to use both eyes and read the lowest line down that you can read for me.
LTFPH.
Awesome. Can you close your left eye for me? And then I want you to read the farthest line down you can backwards.
HPFTL.
Okay. Can you close your right eye for me and then read the farthest line down you can forwards?
LTFPH.
Awesome. And then if she had glasses on, we would do it with and without. Now we're going to move to the near testing. So we're going to test that with the Rosenbaum chart. So I'm going to have you hold this about 14 inches in front of your face. Perfect. And I'm going to do the same thing. I want you to read the farthest line down that you can with both eyes open.
428739.
Awesome. Can you read the farthest, cover your right eye for me? And then can you read the farthest line down that you can backwards for me?
937824.
Okay, and then cover your left eye for me. And then read the farthest line down you can forwards.
428739.
Awesome. Okay. And again, I would do this with and without glasses. Next, we're going to test her peripheral visual fields by confrontation. So what I'm going to do is I am going to sit about 3 feet from her face, and I'm going to have you cover your left eye for me, and I'm going to end up covering my right eye. So I want you to just tell me when you can see my fingers come into your field of vision, okay?
Now.
Awesome. How many fingers am I holding up? 2. Perfect. That's superior, and then tell me when you can see my fingers.
Now.
Okay, and how many fingers am I holding up?
3. 2.
Sounds good. That would be temporal, and then tell me when you can see my fingers.
Now.
Okay, and how many fingers am I holding up?
1.
Perfect. And then that would be inferior, and then tell me when you can see my fingers.
Now.
Awesome. And how many fingers am I holding up?
3.
Sounds good. And that one would be nasal. And then I would repeat the same on the other side. Now we're going to move on to the external eye. So first I'm going to start by inspecting her eyebrows, her eyelids for ptosis, lesions, and edema. So I'm going to be looking at her eyebrows. I'm going to have you close your eyes for me. Perfect. They look symmetrical. Awesome. And then I'm going to move on to inspecting the conjunctiva for colors and exudates. And then also the cornea for clarity. So you can just look right at me. Awesome, looks good. Okay. And then now we're going to move to the iris and pupil. So we're inspecting for size, shape, and equality. So I'm going to have you just look straight at me. I'm just making sure that both of her eyes and pupils are equal. Okay, and then we're going to move on to inspecting the sclera for color. So just inspecting whites of her eyes here. Okay, and then now we're going to go to inspecting the depth of the anterior chamber of her eye using tangential lighting. I'm also going to be kind of looking at the cornea of doing this as well. Perfect, and I'm going to do the other side. Perfect. Okay, sounds good. And now we are going to be performing the upper eyelid aversion for foreign bodies. So I'm going to just have you look straight ahead for me, and if you can close your eyes for me. Awesome. I'm going to grab her eyelashes here, apply some pressure, then open. Oh, sorry. Perfect. Looks good. Okay. We're going to do the same on the other side. I'm going to apply the, okay, you can see that. Good job. Good run now. Okay, now we're going to move on to the neurological section. So we're going to be testing for accommodation. I'm going to have the patient focus on a distant object and then have them focus on my finger about 10 centimeters in front of the patient's nose. So I want you to look straight ahead, and if you can pick a spot on that red wall for me. Okay, I want you to look there, and then I want you to look at the tip of my finger. Awesome, and then look back at the wall, and then back at the tip of my finger. Perfect. And then we are going to now be testing the extraocular muscles in the 6 cardinal fields and doing vertical movement as well. So I just want you to look and pick a spot like on my nose and just keep looking at me, okay? And I want you to keep your head straight, and then I want you to follow my finger with your eyes, okay? Next we are going to do the pupillary light reflex, both directly and consensually. Perfect, Lindsay. Thank you. I am going to put my kind of hand in the middle of her nose. Can you just look? I just want you to look at the tip of my nose, okay? And I'm going to first be going directly, looking at each eye individually and letting them dilate again. And then I'm going to look back at this pupil while I'm looking at the other side consensually. Perfect. Awesome. Looks good. Okay, and then now we're going to move on to the ophthalmoscopic exam. So first we're going to be inspecting the ocular media, the cornea, anterior chamber, the lens, and the vitreous humor, and looking at the red reflex and the opacities. And then while I'm doing that, I'm also going to be looking at, while I'm doing the fundoscopic exam, the ocular fundus to include the discs, vessels, and then the general background, okay? So I'm just going to have you pick a spot right over my shoulder. If you can look kind of pick a spot on that red wall and just keep looking at that, okay? I am going to just put my hand here just to brace, and then I just want you to keep looking at the same spot, okay? I can see the red reflex, and as I'm going back into her eye, I find the vessels, and then I'm able to find her optic disc. Oh, I actually got to see her macula. It's dark. That's good. And then I'm going to do the same on the other side. So I'm going to brace my hand on her eyebrow here, and then again, line this up. I'm going to find the discs and the vessels, and I'm going to move back to find where the optic disc is. Oh, you got some good veins, actually. This is so fun to see. Okay, now we're going to move on to the ear section. You can turn the lights back on for me, if you can. We're first going to be starting by inspecting and palpating the auricles and the mastoid. Okay, we're going to be inspecting the auricles and the mastoid for tenderness, swelling, and any lesions. So first going to be looking at both sides. I'm going to pull the hair back so I can really look at her mastoid, making sure everything looks good, no redness. We're going to be doing the same on the other side. Okay, and your auricle looks good. And then we are going to, let's see here. Oh, inspect with the otoscope for the external auditory canal. We're going to be looking at erythema, discharge, lesions, and any foreign bodies. And then while I'm also using the otoscope, I'm going to be inspecting the tympanic membrane for color, contour, landmarks, perforation, and any fluid, okay? I'm going to pull her ear up and back to the side to kind of align that ear canal a little bit better. Awesome, looks good. We're going to do the same on this side. Perfect, looks good. Okay, now we're going to move on to the whisper test. So I am going to have you just stay looking straight at the wall. Can you cover your left or your right ear for me? And I want you to repeat back the words that I'm saying, okay? 3TR. 3TR. Cool. And I'm going to have you occlude the other side for me as well. Dogfish frog. Dogfish frog. Okay, awesome. We are going to now perform the tuning fork exams. So I'm going to perform the Weber test first. I am going to have you tell me when I put this on the top of your head if you can hear it equally in both ears or louder in one ear or the other, okay? Wait.
It's equal in both.
Perfect. Okay. Let's see here. And then next we're going to do the Renee test. So we're going to be testing air conduction and bone conduction timing. And air conduction should be twice as long as bone conduction. So what I'm going to do first, I'm going to place this on the mastoid process. Just tell me when you can quit hearing it. Now.
Still very strong, very loud. Now.
Okay, so air conduction should be twice as long as bone conduction for that. And you would repeat on the opposite ear as well. We're going to now move on to the nose and the sinuses. So first we're going to start by inspecting the nose for shape and any presence of drainage. So I'm looking both sides, everything looks good. And then we're going to be palpating the nose for any masses or tenderness. And then I'm also going to then next be palpating the frontal and the maxillary sinuses for any areas of tenderness or swelling. So I'm going to first start by feeling her nose and through the bridge of her nose. Okay, and then next we're going to be palpating her frontal sinuses and then maxillary sinuses. And then we are going to be percussing for the same thing for any tenderness and swelling as well, okay? Okay, did that hurt?
No.
Good. Okay, now we're going to inspect with the otoscope. We're going to be looking at the nasal mucosa, the septum, and the turbinates, all for color, alignment, discharge, swelling, bleeding, polyps, and septal deviation. Get a new tip. Oops, on that one. Okay, I'm just going to look right at me, okay? Perfect, looks good. Okay, we're going to move on to the mouth and the pharynx. So we are going to first start by inspecting the lips for color and lesions. Let me get on my gloves and get a tongue blade. I like to. Okay, so I'm going to first start by inspecting the lips for color and lesions. So just looking here, looks good. Perfect. And then we're going to inspect the buccal mucosa and the parotid ducts as well as the Wharton's ducts as well. So I'm going to have you open your mouth for me if you can. Perfect, okay. And then we're going to be inspecting the gums for swelling and lesions, and then I'm going to be inspecting the teeth for occlusions, caries, and any missing teeth as well. So I'm going to have you open your mouth again for me. Looking at the teeth and looking at her gums. Okay, awesome. And then I'm going to inspect the tonsillar area and the oral pharynx for any erythema, swelling, the size of her tonsils, and any exudates. I want you to open your mouth big and wide for me if you can, and I want you to say ah for me. Perfect. Awesome. And then we are going to next palpate the lips and the gingiva for swelling, tenderness, and lesions. And then we're going to palpate the floor of the mouth manually for masses and any thickening. And then lastly, I'm going to end up palpating the tongue for lesions by grabbing her tongue with some gauze. So let me get those off. Actually,
just ring the tassel thing.
Okay, let's do your lips and your gingiva first. So I'm going to have you open your mouth for me. Awesome. Okay, and then we're going to palpate the floor of the mouth manually. And then I'm going to do this. I'm going to have you open your mouth for me. Pop, awesome. Just feeling in through the floor of the mouth here. Looks good. And then we're going to be palpating the tongue. So maybe. I'm going to have you stick your tongue out for me. Awesome. So by doing this, we're going to be inspecting. I'm going to be feeling both sides of her tongue here. Looks good. Underneath, on the top side. Perfect. Okay, and that's it.